Welcome to RR Nursing Zone. In this session we discuss about defense mechanism of adjustment mechanism. Introduction. Adjustment is the process by which our individual maintains a balance between his needs and circumstances that influence the satisfaction of these needs. Defense mechanisms are adjustment mechanisms. Freud in 1904 used the term defense mechanism to refer the unconscious process that defends a person against anxiety. Defense mechanisms enables a person to resolve the conflict and reduce the stress and anxiety associated to it. All of us use defense mechanisms, sometime or the other in our normal behavior. When we used moderately, they are harmless and help us face conflicts and frustrations easily and protect our ego. However, excessive and persistent use of these mechanisms is harmful as they do not solve conflicts and frustrations basically, but only help the individual to make adaptations to distressing experiences. Definition of adjustment mechanism or defense mechanism. Definition. Defense mechanisms, or coping styles, are automatic psychological processes that protect the individual against anxiety and from the awareness of internal or external dangers or stressors. Defense mechanisms can be divided into two types. 1. Successful. Repression. Rationalization. Intellectualization. Compensation. Substitution. Sublimation. 2. Unsuccessful. Suppression. Reaction formation. Displacement. Denial. Isolation. Projection. Regression. Conversion. Fixation. Fantasy. Repression. Repression is basic to all other forms of defense mechanisms. Repression refers to the process by which an individual strives to keep unacceptable, painful, unpalatable and anxiety-provoking needs, urges and feelings associated with them in the unconscious layers of the mind. The occurrence of the process of repression is itself unconscious, and hence the individual is unaware of such urges. We forgot and then forgot that we forgot. Example. 1. People may forget to turn up for an appointment for a treatment they do not like. 2. Mistakes made in nursing patients may be forgotten. The repressed materials forms part of the unconscious level of the mind and may affect behavior without the person being aware. Example. A child may feel angry with his mother because she had punished him. If he feels guilty about his anger, he may repress it and may still be unconsciously angry. This may shown be accidental breaking of his mother's favorite things or in his bedwetting or refusal of food. Rationalization. It is defense mechanism in which an individual justifies his failures and socially unacceptable behavior by giving socially approved reasons. Example: Students who fail in the examination may complain that the hostile atmosphere is not favorable for study. Rationalization is not lying. We believe our explanations. It is like a blanket to cover human weakness. It operates in two forms. A. Sour grapes mechanisms. B. Sweet lemon mechanism. Sour grapes mechanism. A girl who fails to get admission for the nursing course may point out a number of difficulties of the nursing profession. Sweet lemon mechanism. The individual justifies his lower achievements by pointing out their merits. People living in small houses due to financial situation may point out man virtues of small houses. Intellectualization. It is the distancing from an emotional or threatening situation by talking or thinking about it in intellectual terms. A nurse, doctor or paramedical cannot afford to become emotional attachés to each patient. So they use the technique to detaching themselves from emotions through calm abstract statements about the situation. This is a helpful defense mechanism to separate yourself from personal crisis. But to go on using it in all your relationships and experiences is to become very cold and detached individual without healthy emotional experiences. Compensation. It means something given to replace a loss or to make up for defect. A person who fails in his studies may compensate by becoming the college champion. A poor girl who cannot compete with her more beautiful sisters may compensate by studying hard and come first in class. Substitution. The original goals are difficult to achieve and an attempt to achieve them may end in failures. The individual tries to escape this failure or to lessen the effects of actual failure by selecting a new goal or a new situation, which is easier to attain. A student who has not been accepted for admission by medical school may herself satisfy herself by becoming a nurse. Sublimation. It is the channeling of a strong and socially unacceptable desire or urge into a form that is acceptable to society. The most important of these are sexual desires. Others are aggressive feeling, greed and even lying. A young man who has lost his lover may turn into write poetry about love. A person who has aggressive feelings may not be able to express these in society but can become a boxer or soldier. Suppression. It is intentional pushing away from awareness of certain unwelcome ideas, memories or feelings. We merely push them into the background, into our subconscious mind, where they are accessible to us whenever we wish to remember them. A student consciously decides not to think about her weekend so that she can study effectively. A patient may refuse to consider his difficulties by saying that he does not want to talk about it. Reaction formation. It's sometimes possible to conceal a motive from ourselves by giving strong expression to its opposite. Such tendency is called reaction formation. The mother of an unwanted girl child may feel guilty and becomes overindulgent and overprotective of the child to ensure herself that she is a good mother. Displacement. It means to substitute the real object of one's feelings, which are often aggression, with another object. A person who is angry with his boss, but cannot show it for fear of losing the job may fight with his wife and children on return of the office. Denial. Denial of reality is when we refuse to accept or believe the existence of something painful and threatening. Patients of fatally ill children will also deny the serious nature of illness for some time. A patient admitted in psychiatric ward may say that he just needs rest. Denial is quite harmless if practiced in moderation, but can lead to serious difficulties in health and lifestyle if practiced to excess. Withdrawal. Whenever an individual suspects that he is likely to be criticized, ridiculed or disgraced on account of some prior uncomfortable experiences or failures, he resorts to withdrawal. Such a person is seen as avoiding all work, saying that he cannot do this or he cannot do that. It is a protective device by which the individual prevents further hurt and damage to his security by withdrawing from people and avoiding all close interpersonal relations. It may occur as a temporary pattern. They make no real friends. Projection. Projection is a frequently used unconscious mechanism that relieves tension and anxiety by transferring the responsibility for unacceptable ideas, impulses, wishes or thoughts to another person. The student who believes that everybody cheats in examinations may also cheat the same way. The nurse who is poor in clinical practice may claim that all of the healthcare team members are giving poor patient care. Regression. To regress in behavior means to behave in a less mature way, that is, go backwards. An adult behaving like a child is practicing regression. When faced with difficulties of life, the individual reverts to a less mature behavior, where he finds less conflict, and hence less anxiety. The nurse makes of an error in giving medicines or nursing care and then starts crying. Some regressions, such as Tyron becoming very emotional, are quite normal while facing serious problems in life. Extreme forms and degrees of regression result in psychosis. Conversion. Conversion is a defense mechanism by which an emotional conflict is expressed as physical symptom for which there is no demonstrable organic basis. A student nurse, very anxious about her exam, may develop a headache. A woman invited for a party, which presents an upsetting situation to her, may develop gastrointestinal symptoms and may excuse herself from the party. Conversion hysteria is the converting of strong emotional conflicts into such physical symptoms that the very helplessness of the victim will resolve the conflict. A soldier in the battlefield may be deeply upset at the prospect of having to kill or be killed. He develops paralysis of his legs as an unconscious defense mechanism. Identification. The individual feels the personal satisfaction in the success and achievements of other people and groups. The little boy takes the masculine attributes that he admires in his father. May people, while watching a film, identify with the hero and heroine to the extent that they burst into tears when the heroine is shown mercilessly attacked by villains. Fantasy or daydreaming. It is a kind of withdrawal when faced with real problems of life. We retire to a make-believe world, where everything is possible. The tendency to daydreaming is most pronounced during adolescence. When one is having financial problems, one can escape from temporarily by planning how to spend an imaginary fortune. Conclusion. Defense mechanisms are adjustment mechanisms. Defense mechanisms can be divided into two types: successful, unsuccessful. Successful mechanism. Repression. Unconsciously forgetting unpleasant experiences. Rationalization. Making excuses, giving a reason different from the real one for what we are doing. Intellectualization. Distancing oneself from emotional situations by abstract talking or thinking. Compensation. Working hard to make up for a weakness or deficiency. Substitution. The original goals or desires are substituted by others. Sublimation. Directing unacceptable desires into socially acceptable behavior. Unsuccessful defense mechanisms. Suppression. Intentional pushing away from awareness of certain unwelcome ideas, memories and feelings. Reaction formation. Strongly expressing the reverse of what one feels. Displacement. Discharging pent-up feelings on persons less dangerous than those who initially aroused the emotion. Denial. Refusing to believe that something unpleasant exists. Withdrawal. Avoiding all close interpersonal relationships. Projection. Pretending that others have your own feelings. Regression. Acting immaturely. Conversion. Unemotional conflict is expressed by a physical illness or a physical symptom without any organic cause. Identification. Finding satisfaction through what another person does. Fantasy or daydreaming. Withdrawal to make a believe world when faced with real problem. Thank you for watching this video. Have a nice day.